Jugular venous pressure is the measurement of the pressure in internal jugular vein which is located in the neck. It provides valuable information about the status of the right atrium and can be used to evaluate the fluid status and pressure in the central venous system. To measure JVP, have the patient lie at 45-degree angle. Patient need to look to the left to expose the internal jugular vein and locate it between the sternal and clavicular heads of sternocleidomastoid. Unlike the carotid pulse, jugular venous pressure cannot be palpated. Apply gentle abdominal pressure to check for abdominal jugular reflux if unsure. Jugular venous pressure is evaluated using two measuring points, one at the sternum and the other perpendicular to the ground at the level of clavicle. By evaluating the vertical distance between the sternal angle and the highest point of pulsation in the internal jugular vein. When measuring the JVP, a height of 5 cm is typically found from the right atrium to the sternal angle, an additional 3 cm from the sternal angle, resulting in a total JVP of 8 cm of water. If it exceeds, then it is considered as venous distension. JVP waveform shows pressure fluctuation in the internal jugular vein due to right heart pressure changes during the cardiac cycle, featuring three positive waves A, C, and V, and we can appreciate these as pulses during physical examination, and two negative waves which are X and Y. A wave represents the contraction of right atrium during which some blood may be pushed upward into the superior vena cava and into the jugular vein. X descent reflects the relaxation of right atrium resulting in decreased pressure. C wave signifies the closure of tricuspid valve in the contraction of right ventricle. As it contracts, it pushes the tricuspid valve into atria, increasing the pressure to give a small peak, which we can see as C wave. X prime descent marks the end of right ventricular contraction, creating additional space within the pericardium. Enabling the right atrium commence filling with blood causes downward pressure in the tricuspid valve. This decreases the pressure in the right atrium. V wave signifies the filling of right atrium when the tricuspid valve is closed. Y wave indicates the opening of tricuspid valve, allowing the blood from the right atrium to start filling the ventricle. This gives a big drop in the pressure of right atrium. A wave indicates right atrial contraction. Absent A wave can be seen in atrial fibrillation. Enlarged A wave can be seen in pulmonary stenosis and hypertension. Canon A wave can be seen in complete heart block and ventricular arrhythmias. X descent indicates relaxation of right atrium. C wave shows closure of tricuspid valve and the contraction of right ventricle. X prime descent indicates end of right ventricular contraction. V wave shows filling of right atrium when the tricuspid valve is closed, and it is prominent in tricuspid regurgitation. Y wave is the opening of tricuspid valve. Elevated JVP during inspiration is a characteristic feature of constructive pericarditis. To understand how biphasic waves correspond to heart sounds, consider the waveform in relation to S1 and S2. The first pulse occurs just before S1, which signifies the closure of mitral and tricuspid valves. The second pulse is observed immediately after S2, indicating the closure of aortic and pulmonary valves. Thanks for watching. Do not forget to like and subscribe.